Thanks for joining our Community Partners webinar today. My name is Erica Johnson, and I'm Medicaid's Chief of Staff. I have 3 quick housekeeping items for you. 1, closed caption is available for the webinar in both English and in Spanish. Just go to Captions, click on that gear icon that's located at the bottom right-hand corner of your screen, choose Caption/Subtitles and your preferred language. A copy of today's slide deck and the recording will be available on our website tomorrow, and all of the web links that are referenced in the presentation will be accessible within the deck. And finally, please use that Q&A feature to ask your questions and to provide comments, and we'll try to answer as many questions as we can by the end of the webinar. Next slide. Next slide. All right, and just as a reminder, the purpose of the Community Partners webinar is to keep you informed of what's happening in North Carolina Medicaid and to provide you with information that you can share with our Medicaid beneficiaries and stakeholders. The target audience is beneficiaries, county agencies, and local community partners. Although our Medicaid providers may find the information shared today very helpful, there are other resources that are designed for the provider information, and we will share a provider resources slide at the end of the webinar. Next slide. All right, we have an agenda full of information for you today. We'll have an update on Medicaid expansion. We'll talk about our CFSP Health Plan Award. We'll talk about medical debt relief, Medicaid recertification. We'll talk about our resources, and then we'll have time for Q&A. Well, let's go ahead and get started. Here to bring us an update on Medicaid expansion, please help me welcome the Deputy Secretary of Medicaid, Mr. Jay Ludlam.
Thank you, Erica. I really appreciate the introduction. Before I dive into my prepared slides, I did want to provide the folks here with an update on the North Carolina Medicaid budget. I think as many of you know, yesterday the House passed the rebase budget in addition to some other items in what is called a mini budget. The Senate had passed the same bill earlier in the week. And so now it sits on the governor's desk for signature or for enactment or potential veto. What I want to highlight is that while Medicaid did not in this budget get fully funded for the amounts that we need, we are not going to take aggressive steps to address what that potential shortfall is. We're going to take our time, be prudent, be thoughtful about the program, continue to evaluate where our money is, what we're spending, what we're receiving, and just continue to monitor and work closely with the North Carolina General Assembly if we have any shortfalls. So more to come on that. But otherwise, I'm ready to dive into expansion. I hope you are. So today, we have 543,560 individuals who have been moved to the Medicaid expansion benefit or have applied for it. As you are aware, our 2-year goal is to reach 600,000 adults that we anticipate will be eligible or will eventually sign up for Medicaid expansion. In fact, that is a 2-year goal. We are not yet in a full year's worth of Medicaid expansion, but as you can see, we are well on our way to reaching that 600,000 person goal. There are resources, the Medicaid expansion dashboard, as well as additional information available on our website. Of course, I want to thank the community of North Carolina for making the Medicaid expansion rollout so successful. Without you, we would not have been able to get the message out that Medicaid had expanded, that folks who had applied in the past and maybe not gotten accepted for Medicaid should reapply because the rules had changed. And so it is your ability to get that message out. It is your opportunity to provide us feedback on how we can reach different communities across North Carolina to get more information to folks. We rely on you. And so we appreciate your partnership and the work that you're doing to help your neighbors and fellow community members get into Medicaid and get on Medicaid expansion. Next slide. Thank you. What I also want to announce today is, we've been busy, is the awardee for the Children and Family Specialty Health Plans. So what does CFSP stand for? It is Children and Family Specialty Health Plan. It is a single statewide Medicaid managed care organization that will provide a whole person service array and suite of services for children, youth, and their families who are engaged with the child welfare system. The goal is to create one accountable organization that has that statewide profile and that they offer coordinated care management services to provide seamless and integrated care for individuals so that they can get access to physical health, behavioral health, and those social determinant healthy opportunities benefits. We have a press release and we have some other web pages, but we're very excited to award to Blue Cross Blue Shield of North Carolina, who was selected through a competitive procurement to operate the Children and Families Specialty Health Plan. Next slide. Here's a little bit more detail about our CFSP. Like I said, it's statewide. It'll provide physical health services or access to physical health services. It'll also offer access to behavioral health services such as outpatient therapies, inpatient treatment, crisis and therapeutic residential options for children. Individuals will be eligible for the 1915I services, as well as, if they qualify, for intellectual developmental disabilities, long-term services and supports, of course, pharmacy services, and like I said, in participating regions of North Carolina, until we get the new 1115 waiver approved, folks in those 33 counties across North Carolina who qualify will have access to unmet health resource needs, including food, transportation, housing, and interpersonal violence wraparound services. Those will be provided through our Healthy Opportunities program. I think that is my last slide. To Julia Lurch.
Hi, good afternoon, everyone. I'm Julia Lurch, and I'm the Chief Strategy Officer and Chief Actuary at North Carolina Medicaid. And I'm very excited to be here today to tell you about an exciting program that we implemented over the last few months to address the issue of medical debt in North Carolina. So we recently implemented this hospital incentive program to address the burden of medical debt on low-income North Carolinians. We are happy to announce that all 99 eligible acute care hospitals have agreed to participate in this incentive program. The program will provide relief for past medical debt for individuals who now have Medicaid, including individuals who are on the limited family planning benefit, and also for individuals with incomes below 350% of the federal poverty level or with debt of more than 5% of income. There are some exceptions for individuals who have already set up a payment program with their hospital, but otherwise this provides huge relief to nearly 2 million low and middle income North Carolinians who are experiencing debt of approximately $4 billion. We also are working with the hospitals as part of this program to implement additional policies to reduce the accumulation of medical debt going forward for low and middle income North Carolinians. And I did want to just say for a moment, why did we want to address medical debt? We received feedback from people across the state who were, of course, very relieved to have coverage through Medicaid expansion. As Jay mentioned before, we now have more than 540,000 individuals who are enrolled in that program receiving full benefits that they otherwise would not have been eligible for. But folks were still weighed down by past medical debt that they had incurred over the last decade. And we know that medical debt can lead to avoidance of needed medical care, which is a serious concern, of course, for all of us, and especially in Medicaid. It can lead to personal bankruptcy, food insecurity. It can limit people's opportunity to build wealth or access higher paying jobs. So, for example, it may interfere with them paying for education or buying a home. And interestingly, or not great news, but North Carolina has the third highest percent of households with medical debt in collections across the U.S. So it's really a significant problem for families in North Carolina. So we're very happy to be addressing medical debt through this program. And just so folks are aware, there's no action that's needed by patients. Participating hospitals will be working to automatically relieve outstanding debt for individuals who are now on Medicaid, and that will be happening over the next several months. And in addition to that, for the other eligible individuals, those are individuals with incomes up to 350% of the federal poverty level, or who have outstanding debt more than 5% of their income. Our participating hospitals will work with a third-party vendor to identify that outstanding debt that's eligible for relief, and that will happen over the period of a couple of years. So the Medicaid enrollee debt relief will happen sooner than that for other eligible individuals. The participating hospitals will also implement new policies designed to prevent low and middle income consumers from accumulating medical debt in the future. And this includes several components. First is that there will be discounts on medical bills of between 50 and 100% for patients with incomes at or below 300% of the federal poverty level, and that will be on a sliding scale basis. We are working with the hospital so that over time they will be automatically enrolling patients who have data that shows that they meet that income eligibility. They'll be automatically enrolled into financial assistance to allow for streamlining of that process to eliminate some of the administrative barriers to accessing charity care that is available through hospitals. And then we'll also be prohibiting the sale of medical debt to third-party collection agencies for consumers, so that that will limit the ability of or limit hospitals reporting medical debt to collection agencies, and also impacting their credit reports. All right, in terms of the timeline, hospitals have started the work already to implement these policies. On October 1st, they need to submit to Medicaid in some progress reports, and then by January 1st of 2025, they will need to have published policies in place with the new discount arrangements, so the charity care discounts that are based on income. And there will also be a streamlined screening process for individuals that will help folks automatically qualify for charity care if they're enrolled in a public benefit program. And then by July of 2025, the hospitals will be implementing these policies that curb aggressive debt collection processes. So, for example, there will be a cap on interest rates for medical debt and other items as well. And I'll pop into the chat the link to additional information. Hospitals by July of 2025 will also have to stop reporting to credit agencies, and they will have to have forgiven the past debt for individuals enrolled in Medicaid. As I mentioned before, it will take a little bit longer for hospitals to implement medical debt relief for those who are not in Medicaid but have incomes up to 350% of the federal poverty level, or who have medical debt exceeding 5% of their income. So I will put in the Q&A the link where you can find more information, but we are very excited about this program and happy to answer any questions when we get to the Q&A period. Back to you, Erica. I'm not sure who's next. Melanie, thanks.
Thanks, Julia, and good afternoon, everyone. My name is Melanie Bush. I am the Deputy Medicaid Director here at North Carolina Medicaid, and I'm going to be talking today about Medicaid recertifications. As many of you may know, during the public health emergency, we did not terminate anyone from the Medicaid program. But starting in April of last year, we began a process called the Continuous Coverage Unwinding. That period of time where we were supposed to do renewals on everyone who had not received a renewal is coming to an end. But of course, Medicaid renewals are not ending. We have to do those either every 6 months or every 12 months, depending on what Medicaid program you're enrolled in. So these will be ongoing. Generally, what happens is your eligibility, we try to determine your eligibility based on the electronic resources that we have within our system. And if we can determine you eligible for the same benefit you're in or a better benefit, then that will automatically happen and there is nothing for you to do. That is the happy path. But sometimes not enough information is returned to make an eligibility determination. And so a caseworker will then send you a request for additional information. And so we want to talk about what folks should be looking for and what folks can do to make sure that they continue to remain eligible for the Medicaid program. Important reminder is that there is never any charge to enroll in Medicaid. So your county DSSs, the North Carolina Medicaid program will never request money in exchange for enrollment. That is a scam. And so to report scams, we do have a 1-800 number that we highly recommend. If you find that someone is doing this, please report them so that we can stop that action. Right. Next. So what do you need to know? We absolutely want folks to always update their information with their county DSSs. Update your contact information, your address, importantly, because any request for additional information will come directly to you in the mail, but also email address or text messages. We communicate now post-pandemic online with many of our beneficiaries. Folks find it much easier to communicate that way. And so we ask that you update your information. You can contact your local county DSS. We do have a directory on our website. Always open any mail that you get from your county DSS that's likely telling you important information. You either need to take an action or it's telling you what your coverage is. So if DSS needs more information to determine your eligibility, open the letter and send that information back as quickly as possible. If your Medicaid is renewed, you will get a letter saying that your benefits are the same or if they're better. There's nothing you need to do. And then if your Medicaid was not renewed, it'll either tell you that the reasons why and how you can appeal and what other resources there may be. And I think I'll talk about that in a few more slides. Next slide. We do have a whole, yes, as Jay mentioned, we have 543,000 people now that have new health care coverage through expansion and may not have gone because we haven't completed a full year, may not have gone through the renewal process before. So it is important that everybody do know to keep your information updated and open any mail from your county DSS. Folks who got coverage starting in December of last year when we launched expansion will be up for renewal in December of this year. Our county DSSs start working on those in the months of October, November, and December. So we need to make sure that those beneficiaries keep their eyes out for anything coming from a county DSS because we want folks to remain enrolled. And then what does happen if you are determined ineligible? So the letter that you would receive will tell you why, the reason that the county determined that you were ineligible for Medicaid. If it's because you fail to provide information, you can contact your county DSS and provide that additional information, and they can determine you eligible at that time. If you are no longer eligible for the program because you make too much money or other reasons, then you can go to the federally facilitated marketplace at healthcare.gov, and you will likely be eligible for coverage and subsidies for healthcare on the federal healthcare exchange. There's also in every single notice appeal rights. If you believe that the determination has been made in error, you do have the rights of appeal, and it will lay out those options for you in your notice. You can also reapply for Medicaid at any time. So now I think I will turn it over to Kathy.
Thanks, Melanie. Just wanted to give you some information and resources to make sure that you have everything you need. We have worked with the Hispanic Federation to create a Hispanic Federation hotline. It is a health hotline that is dedicated to serving the Spanish-speaking community in North Carolina. Residents can reach the hotline at the number here. All the call representatives are bilingual and ready to assist with things such as questions related to Medicaid, how the Federal Health Insurance Marketplace or healthcare.gov, general information about eligibility. They can make referrals to bilingual individuals who can help you fill out Medicaid application or the healthcare.gov application. They can also give you information about low-cost medical services that are available in the caller's county of residence. Next slide. We are still looking for Medicaid ambassadors. Our goal is to have all 100 counties have at least one Medicaid ambassador, but we would hope to have several. So if you're interested in becoming a Medicaid ambassador, the information on what to do is listed here. As a reminder, Medicaid ambassadors are volunteers who will work with people interested in applying for Medicaid and help them to apply and show them how to use the ePass program that we have online. Just send us an email if you have an interest. We'll have you complete the Medicaid Essentials training, the ePass training, and then we need to have a confidentiality agreement with your organization and have you sign the attestation form with Medicaid that you meet all the requirements. As a reminder, we do have several resources if you need to learn about ePass. We have a fact sheet in English and Spanish. We have how-to videos in both English and Spanish, the website, and then if you have problems or questions about completing ePass, you can contact your local DSS at the directory listed here. Wanted to share with you all, in case you're interested, we are offering for free bilingual print materials at no cost, and that includes shipping. You need to order before Friday, September 20th. We have a QR code available as well as the link. We have flyers available about what tailored plans are, tailored care management. We're offering information on non-emergency transportation, and you can also get that in a poster size. So feel free to come order. And like I said, the deadline is Friday, September 20th. And for providers, just in case you needed to know some additional resources, since we don't really cover provider information, we've put together a list of resources available to you. The Medicaid website, which has both county and provider playbooks with information specific to working with providers. If you have questions, we suggest that you go to our help center. We regularly publish knowledge articles, so sometimes you might find the answer to your question right there. We do post regular Medicaid bulletins, so we encourage you to watch for the bulletins. And we hold our quarterly managed care webinar series hosted by us and AHEC. The next event will be November 21st. We are moving the time from 5 o'clock to noon, so hopefully that will allow more people to attend. And the link is there to register. You can also view previous webinars at that link as well. I think now I am going to turn it back to Melanie for questions and answers.
Great, thanks, Kathy. We do have a number of questions. I'm going to start with an eligibility question. I would like to know more about who can receive healthcare coverage for people who are undocumented or have visas. And so the answer to this question, and I'm going to post a link to a fact sheet in the chat. Folks who are undocumented do not have access to full Medicaid coverage. If you are undocumented, the only thing that Medicaid will pay for is emergency services and emergency department and pregnant women, labor and delivery. You do have to have qualified immigration status to be eligible for the Medicaid program. Many people in this category also have to have been in the United States for 5 or more years. So there's lots of very detailed information. I'm going to put it in the chat for you to learn more about that. But this information is also available on our website. Okay, I'm going to, there was a question about Medicaid ambassadors. I'm going to send this to you, Kathy. Can someone who is already assisting clients at our agency take the Medicaid training to be an ambassador, to be more knowledgeable about the process, but not to volunteer for, to stay, but to continue assisting within our agency? So I think what this question is if we already have people that are helping folks assist clients, can they become Medicaid ambassadors and continue to work at the agency?
Yes, there is no official commitment as far as time when you want to volunteer to become a Medicaid ambassador. The role is to just help individuals understand the Medicaid application process and how to use ePass, our online system. We do not provide live and in-person training. We have a toolkit, so you go and learn how to become an ambassador. It's a self-learning module, and it has numerous resources to help you assist people. In addition, we host regular office hours in case you have questions.
Terrific. Julia, I have 2 medical debt questions here that I'm going to ask you to respond to. The first is, where is the funding coming from to forgive the medical debt? And then the second is, will the debt relief program improve credit scores with people with old medical debt when the debt is waived? Or will it be counted as income?
Okay, now I forgot both questions because I was trying to hold them both in my head.
Where's the funding coming to relieve medical debt?
Okay, thank you. One at a time is helpful. So the funding for this, so the hospitals have, this is outstanding medical debt owed to hospitals. The debt is worth pennies to the dollar because a lot of this is debt that people can't afford to pay. And so even though it's worth $4 billion, that's the amount of debt that is on the backs of individuals who have this debt, the actual value of it to the hospitals is much less than that. And while it's not directly funded by the state, we are providing incentive payments to hospitals under a Medicaid hospital program that we have authorized through the federal government. And so if a hospital agrees to participate in the medical debt relief program, they get incentive payments from the state. It's not a one-to-one relationship between the medical debt that they're relieving, but it is a very substantial incentive for them to participate in the medical debt relief. All right, sorry, what was the second question, Melanie?
This is probably a question you don't know the answer to, but the question was, if the debt is relieved, does that count as income and does it affect credit scores?
So I think that's maybe two separate questions. So if the debt is relieved, it should not impact someone's income, meaning that there should not be any tax implications to that individual for the debt relief. The way that the program has been designed, the debt will either be recharacterized as charity care, or the debt will be donated to an organization that will then relieve it. So based on the structure that's set up, there should be no income tax implications for individuals. And the part of this program is for hospitals to stop reporting debt to credit agencies. That will happen, I believe, by July 1st of next year. I don't have the dates right in front of me, but at a certain point in time, the hospitals will no longer be, participating hospitals will no longer be reporting medical debt to credit agencies. Thank you for the questions.
And there's one more I'm going to follow up, Julia, while you're in the hot seat. Will debt relief available to hospitals ever be expanded to outpatient treatment centers in the future?
We don't have plans to do that at this time because those outpatient, if they're not connected to a hospital, those centers are not part of our hospital payment program that these incentives are tied to. So unfortunately, we don't have the same lever to use for those entities.
Thank you. All right, Sandy Danner, I'm going to send a couple of eligibility related questions your way. The first is, if you get a letter saying you're approved for Medicaid, upgraded from family planning, but in the meantime, you obtained private health insurance at your own cost, can you still use Medicaid and not use your personal insurance?
Great question. Hi, I'm Sandy Danner. You can have Medicaid and you can have private insurance. Medicaid is the payer of last resort, but you will use your private insurance first, and then you will use your Medicaid. So you can do both.
Terrific. This is sort of related. Can patients have Medicare and Medicaid at the same time?
They can definitely have Medicare and Medicaid at the same time. That is called being dual eligible. And what happens is, again, Medicaid is the payer of last resort. So the Medicare would pay first, but Medicaid could also assist in premium payments for your Medicare premium, and to help with that cost. So yes, you can actually have Medicare and Medicaid. Now, not with expansion. I guess maybe I need to clarify a little bit. You are not eligible for expansion if you have Medicare, but if you have adult Medicaid, you can qualify for both Medicaid and Medicare. But expansion, no. Once you're eligible for Medicare, you're no longer eligible for Medicaid expansion.
All right, terrific. Kathy, I'm not sure you can answer this question, but we do have a question about calling for Medicaid medical transportation services. What number would a person call to be able to access the transportation services when they speak another language other than English or Spanish? I'm not sure if you know the answer to that response. Go ahead.
Would have to double check, but they should have a language line available that they can use. If you want to drop your email in the Q&A, we can find out for sure and get back with you.
Actually, I'm gonna give your email, Kathy, to this person, and they can contact you if they need to.
Perfect.
That would be better. Okay. All right, terrific. Let's see what other questions we have. My daughter was just approved for Medicaid expansion. Jay Ludlam. Will she ever be required to pay anything back?
So as a Medicaid participant, I actually don't know the technical answer. Putting a lot of different things together, I don't think that she would have any obligations.
She would not, no.
Is that a quiz?
It's not a quiz. It was a very good question.
It is a good question.
If you were eligible for Medicaid and you receive services as an enrolled Medicaid beneficiary, then you are not required to pay anything back unless you're determined fraudulently applying for Medicaid eligibility. There may be some implications, but no, Medicaid is available to beneficiaries at very low cost. Our copays are capped at $4. So other than that, there's no financial obligation. All right. I'm looking through a lot of questions, trying to see the best next question. Jay Ludlam, what do you see is the next big step for Medicaid moving forward?
Yeah, Jay Ludlam, Deputy Secretary for Medicaid. I think the next big step is really using the investments that we have made as a state in bolstering and strengthening our behavioral health system, moving to Medicaid managed care, expanding Medicaid, and continued demonstrated success and healthy opportunities. Is the opportunity now really for us to use all four of these tools to foster and feed our goals around whole person care, around the Children and Family Specialty Health Plan is another good example. That's whole family. How do we wrap around the families and potentially even prevent a foster care event? And so there's a real opportunity for us to use the tools that we have built and use those to increase and improve the health of North Carolinians, to strengthen community, to keep families together, to make productive and engaged communities. So I think in some ways it's not as cool as Medicaid expansion, but we've made that big investment. So now let's use it and let's and make sure that we get the full value of it. I will take a quick moment because I should have done this during my slides. I do want to emphasize that Medicaid expansion does not use any general fund dollars to fund it. And what that means is that the federal government, and through some hospital assessments, we're able to pay for that program. So those 543,560 individuals, those individuals are on Medicaid, receiving access to health, receiving access to behavioral health services, physical health services, SDOH services where they qualify at no cost to the North Carolina taxpayer. And I think it's the opportunity to leverage those big investments is going to be the next thing for North Carolina Medicaid.
Thank you, Jay. Right, I see a question. Hospital is seeing a patient's Medicaid expansion coverage terminated by the surrounding counties after 6 months, although the approval letters specify a 12-month cert period. I think you need to contact county DSSs in that specific case. That does not sound right. If an individual is eligible for 12 months, they should remain eligible the entire time. There's another question, which population, Medicaid population, or is it the entire Medicaid population that qualifies for using the GLP-1 medications for weight loss as of 8/1/24? That is a covered benefit for the entire Medicaid population, assuming that you qualify for the clinical criteria for that medication, and that is available to everyone in the Medicaid program.
But it's not eligible to family planning, right? So there are limited
That's
benefits.
correct. You have to be on a full benefit. That's correct. That's an important distinction, Jay. That's right. You have to be enrolled in a full coverage Medicaid, not on a limited benefit plan like family planning. When, Sandy, maybe we can talk through this. When can an illegal pregnant woman apply for Medicaid?
She can apply for Medicaid for a labor and delivery anytime during the month of birth or retroactively up to 3 months retroactively after the baby is born. But she can apply for an emergency benefit for that.
All right, terrific. Sandy, this is also eligibility related, so I'm going to throw it to you again. If a person has another insurance with Medicaid, how do you get Medicaid to pay the claim?
Medicaid will pay. They are the payer of last resort, so the private insurance would pay first, and after that claim is paid, then it could be turned over to Medicaid. So just give your provider your private insurance card and your Medicaid card.
Perfect. And one more, while you're in the hot seat, if an adult has a change of circumstance, do caseworkers, are they allowed to make changes or terminations to a case?
Yes, they absolutely are. Now, with that being said, it is critical that the caseworkers, and they are doing this, and we're reviewing this with them on a daily and weekly basis, but they need to evaluate that individual. When an individual is not eligible in one Medicaid program, it is critical for those caseworkers to evaluate that individual for all other Medicaid programs to determine if they are eligible for any program. Now, if they are not, then they will get termination notices. They will actually get timely notices saying, you no longer qualify for this program. They will get adequate notice for that. And then if they are not eligible, they will be terminated. But just keep in mind that there's also the marketplace, so they can also try to get coverage for the marketplace if they're no longer eligible for Medicaid.
And then finally, is there a certain age that a child is no longer eligible for Medicaid, Sandy?
So with the changes, we now have Medicaid expansion. There still is a different income limit when you turn 19, but we now have expansion. So a child could be eligible ongoing because we have the different programs. Prior to expansion, it was a lot more difficult to be eligible after the age of 21. But now with expansion, we have just opened it up to eligibility for so many more individuals.
Terrific. Here's a question for you, Maria. Can clients with the tribal option eligibility participate in the Healthy Opportunity pilots now?
At this time, tribal option members are not HOP eligible unless they are enrolled with a standard plan or a tailored plan. There is work being done to try to expand HOP eligibility to those populations, but we do not yet have a timeline.
Do you have a question about, do Trillium patients get value-added benefits like other health plans? The answer to that question is yes. All of our health plans offer value-added services, and you can compare those health plans at our enrollment broker website, ncmedicaidplans.gov, and you can click on View Plans, and you can, in fact, even compare them based on the value-added services that they provide. How long does it take to get a determination from Medicaid? Generally, the county DSSs have a requirement to process applications within 45 days, but it takes much shorter time if it is all of the information is complete and correct, and if all of the information is provided when requested. There are some certain circumstances where it may take longer for an individual to be determined eligible, for example, if they're applying for disability. But now that we have Medicaid expansion, an individual can be enrolled in Medicaid expansion while that disability determination is being evaluated if they meet Medicaid expansion eligibility. Is it true? This is another eligibility question, Sandy. Is it true that Medicaid will pursue an estate recovery after a Medicaid recipient has passed away in order to help pay for the services they received throughout their lifetime?
So that is a good question, and I was wondering if that was kind of the direction that other question was taking. So estate recovery is when an individual is placed in a nursing facility. After their death, if there are any resources in their name at that point, Medicaid may come in as a fifth class lien and possibly recoup from that estate. That is only for nursing facility services and for up to the amount that has been paid by North Carolina Medicaid. So it is not for regular Medicaid services. It is not for expansion. It is only for those long-term care services that estate recovery would even come into play.
Terrific. Maria, I want to give you an opportunity to clarify a question response.
Yes,
about
as
tribal
a clarification.
members.
Yes, as a clarification, and apologies for missing this. For members that are whose care is managed by a PIHP, they would also be HOP eligible if they are eligible for tailored care management or TCM. And again, for all others, we are still assessing the pathway for eligibility.
All right, we have a question wanting more information about 1915I for community services. This is a new program in the North Carolina Medicaid benefit. 1915I services are designed to support independence at home and in the community. That started last year on July 1st. These are specifically services for individuals with serious mental illness, severe substance use, traumatic brain injuries, or intellectual and developmental disabilities. If you're on the wait list for NC Innovations or the TBI waiver, you can get these services without losing your spot. But you do need an assessment to get 1915I services. If you're getting similar services through the 1915B3 program, these will be replaced by 1915I services. And so to keep getting those services, you'll have to have an assessment and need to work with your tailored plan or your LME MCO to get that assessment. All right. Are EBCI members eligible for tailored care management if they are in the EBCI tribal option? And Julia or Maria, can someone
that is a
answer that
question I would need
question?
to take back. Unfortunately, I don't have that
Okay.
answer readily available.
All right, we will follow up and get you the right question or the right answer to that question. Thank you for writing in.
Oh, it looks like, sorry. Looks like we got an answer from some of the folks who are also on the line. So tribal option members do default to tribal option and have to opt into TCM in the geographic region where they're eligible.
Right. In terms of the future of managed care, I'll send this one your way, Jay. When are dually eligible beneficiaries going into managed care? Is there a plan for that?
We're in the process right now of planning the plan for the dually eligible health plan, that implementation. We, as you saw earlier, or as you participated with us probably on many of these, you've seen us launch the standard plan, work through the tailored plan, and now are in the process of developing and launching the Children and Family Specialty Health Plan. So the dually eligible health plan, I would say, is next, but that we're really in the planning stages at this point.
Terrific. Take one more question. Sandy, so I'm sorry. Sorry. Sandy, I will ask you this question. How do we tell the difference between tailored plan and regular Medicaid for behavioral health when verifying eligibility in NCTRACS? Can you speak to that?
So in NCTRACS, excuse me, the MC status is going to be different. And also in NCTRACS, it will show the tailored plan in NCTRACS for the eligibility segment on that individual. So you should be able to see the difference, but not in TRACS. Remember, those individuals also have a different Medicaid ID card. They have an ID card that is from that tailored plan. So I know you asked specifically about the NCTRACS, and yes, that is the MC status code, and the tailored plan will be listed, but also the Medicaid ID card will be different. I hope that helps.
That does. Thank you. Thank you all to everyone who attended this webinar and who also asked the questions. Thank you to our panel of experts that answered the questions. I will turn it back over to you, Erica, to close us out.
All right. Let me also say thank you to Melanie for orchestrating and handling all of those questions that came in. Thank you guys so much for your participation. Thank you for your questions and your comments. Just again, a reminder, a copy of today's slide deck and the recording will be available on the website tomorrow. Thank you for joining us today. Have a great day.